Hey guys. Okay, so we just finished navigating through the Sapphire Teams portal, and we are back because I wanted to make sure that we get that oncology chapter in. And I was checking to see if we had anything on oncology in my little book right here. So, those of you who do not have your book, that's fine. You guys can always archive this video till you get your book, and you can always archive any chapter. This one, we're going to do chapter 19, but again, I want you to make sure that you have your CPT book in front of you when you are doing most of these chats, okay? We are in the language of medicine, medical terminology book, and we're here. I'm going to share my screen with you. Okay. Hold on. Let me get you in there. So yeah, we're going to share our screen, and then we'll go over a couple of things that we went over before. I just want to show you where we're going to be at. Some of you may be late, or some of you may be archiving this a little later on. Okay. So I keep forgetting I'm in the same screen. So here we are on chapter 19, cancer medicine oncology. So in your CPT book, the medicine section is one of the last chapters in your CPT book. So when you get your CPT book, just try and have them together so that you can see what's going on in the medicine section in the CPT book. Now, I'm going to also share my screen and show you that Kindle book. Now, some of you who have not been coding, you're a new coder, you've never coded before, you still can get the Kindle book and get an idea of how to code. What are we coding? How do you do it? I'll share my screen with you for this. So again, the links that were in the prior chat, and I'm pretty sure I have links below. One of those links is this 2025 CPT book. So if you don't have your book, you can use this book as well, okay? And again, these are good for you to kind of learn what CPT is, how do we code, what is Unit 99215, what are those, what are E&M codes, what are ambulatory codes. This is, we're not copywriting anything, this is Kindle, this is actually the free part of Kindle. Okay, and you get a few chapters with this. So I would definitely like for you to, read the guidelines of the CPT, even before we get to the CPT coding, okay, or the ICD-10. See general criteria for category 1, 2, and 3. So some of you, again, who do not have your books, some of you just who want to know what the coding is, this is the gusto of the coding. Okay, this is where we're going to start from scratch. So here we're talking about cancer in the medicine section of oncology. So they're going to give us some cancer treatments, terminologies, some tests, abbreviations. And again, YTU, you are reading this full chapter on your own. The Sapphire students, you are as well. Okay, the Sapphire students, you have your test that you're going to do after this, okay? And you have your exercises if you choose to. The Sapphire book is a little bit different. The exercises come in one format, and then the reading material comes in another format. In this 2025, it's all together. It's all together. Okay, so same thing as up there. We start with introduction. They're going to start with tumors, carcinogenesis, classifications, pathogens, treatments, vocabulary, terminology, and then we'll go into clinical tests and abbreviations. Okay, so let's we always kind of take a look at the picture that they have here. So here we're at the goals, and it's pretty much talking about let me get rid of that. It's pretty much talking about, what we're getting ready to get into as far as the oncology section. So what we're talking about right now is just your introduction of what you're going to be learning in this section. So again, these are the goals for the oncology section here. Okay. So I want to pretty much let you know what's in there. Identify medical terms that describe the growth and spread of tumors. Recognize terms related to the cause, diagnosis, and treatment of cancer. Review how tumors are classified and described by pathogens. Okay, describe x-ray studies, laboratory tests, apply new knowledge and understanding. So, that's generally what it is. And again, you guys know we always kind of start off with a picture of the chapter. And that's the picture of the chapter really quickly. Okay, so again, that's the goal for us to learn here. Now, here, this is just your introduction to the medical terminology of language of medicine. The medical terminology of language of medicine is complicit with your CPT coding. To do your CPT coding in oncology section, you need to have knowledge of oncology language. That's what we get ready to do now. So I'm on page 745. I'm not sure what page you guys are on, but I'm just going to go over the introduction. I'm just going to kind of skip over some words, but you guys have that at home. You guys go ahead and read that. Those of you who are in the Sapphire class, do not forget the program comes with a language of medicine book. Okay, so I encourage all of my YTU students to join the Sapphire program. Go to the website, join the program. I'm gonna put the link over here, even though the link is below, so you guys can kind of look at some of those courses in the bookstore. Okay, in order for you to join the Sapphire portal, Sapphire program, you have to be in the program. Okay, so hopefully you guys got your book. Cancer is a disease caused by abnormal and excessive growth of cells in the body. Abnormal and excessive cells in the body, okay? It may arise in any tissue and appear at any time of life, okay? Although cancer occurs most frequently in older people, cancer cells accumulate as growth called malignant tumors that compress, invade, and ultimately destroy the surrounding of normal tissue. So, as vague as it sounds, that's such an important description that some people may not know. When you guys are studying, I want you to make sure that you are putting this on your index cards, okay? Malignant tumors that compress, invade, and ultimately destroy the surrounding normal tissue. To me, it literally just eats at your whole body. Living organisms are gone. In addition to their local growth, cancerous cells spread throughout the body by ways of the bloodstream or lymphatic vessels. You guys know we just went over lymphatic. Go over that again if you're not familiar with the lymphatic vessels. Okay, in your CPT book, you will go over lymphatic system again. Okay, you will go over that again. Okay, so you can see the more we do, the better. The more study we do, even if it's in different formats. So this is how you guys are going to retain most of what we are doing. It's repetitious. Your step-by-step coding book has a lymphatic system in there. Your step-by-step coding book has oncology in there. We're going to go over the same thing, but in a different format, different coordination. Medical terminology, step-by-step, your CPT, your HCPCS are complicit. They're all together. So when we get ready to do the coding, you're already going to have an idea of oncology and what you're looking for. Okay, you're going to have an idea. But again, the more you study, the more you learn. Okay, so what do we leave? In addition to their local growths, cancerous cells spread throughout the body by way of bloodstream or lymphatic vessels. In some patients, the spread of cancers from their site of origin to the distant organs occurs early in the course of a tumor growth, okay, and ultimately resulting in death. It is more than likely metastasizing or metastasis. That's developing into something else. Metastasizing is moving. The cancer is moving to another area. So, when you get ready to do that, you'll be amazed at how that thing works. You'll be amazed when you see these words going into CPT and ICD-10. Although nearly 2/3 of all patients who develop cancer are cured, okay, of their disease. Did you know that 2/3 of patients who get cancer are cured? About 600,000 people die of cancer in the United States each year. Man, can you believe that? To me, I don't understand how they cannot get this thing under control. You just can't get it under control. You can get the HIV, the immune deficiency, you can get it under control, but you have to keep working at. They have to keep working at this. One day they will. One day they will. Lung cancers, followed by breast and colorectal cancers, are the most common cause of death for women. See, at one point I thought that they had the breast cancer under control. My bestest friends, oh my God, I can't even think about my breakdown and cry right now. Can't. My bestest friends. We were 10, 11 years old, like this. Their mother got it. And then the father, was in the hospital, and we were there, my besties and their brother, and we were just waiting for that call, and all we kept sitting around, we was holding hands, and they were like, one of us is going to get it. One of us is going to get it. And mind you, we were 10 and 11 years old, and they were sisters, and they look at each other, and we look at each other, and we just be like, and I was like, no, y'all not. No, y'all not. And they were serious. We're going to get it. One of us is going to get it. And about 11 p.m. late that night, they called, and their dad had passed with it. It was horrible. The bad news that I have to tell y'all is that my bestie, when she was in probably her 30s and early 40s, she got it. She passed away. The other bad news is, as I even came to Georgia, I looked for my other bestie, and I didn't even know she passed away. Her daughter told me, mommy gone. I said, what? What happened? I'm like, and it's like the worst news in the world. And it's like, all I could do was remember when we were 10 and 11 years old, and we sat around and held hands, and they were like, one of us is going to get it. And that was so long ago. I would think that they would have something to control cancer by now, but they don't. So we have to pray for that, And when I went to St. John University for about 2 years, and I had started, then I stopped, because at first I wanted to be an attorney, and I went to St. John's, and then I decided to go back to St. John's, and I had to write an essay so I could get back in. And my essay was about my bestie. Not about my other besties. My bestie's mother, she passed, and she had the breast cancer. And I got back in. I got an A++ for that essay. But when you think of all these people that I'm pretty sure, just like COVID, my aunt, it did everything. You think of these people, you go, is there anything in this world that they even care about? Even this thing that's going on with the CDC and the new guy. I hope they fix that, because God forbid COVID come back, Okay, let's move on. Y'all know how I get it. We can ready to get into cancer, so that's like a touchy subject for me, but I want y'all to make sure y'all go through this, because there are going to be oncology questions on your test. Okay, characteristics of tumors. Tumors are neoplasms, okay, are new growths that arise from normal tissue, okay. New growth that arise from normal tissue. Y'all know I got a story for everything. So, when I used to be CNA, I actually started out as a CNA even before I went to the OR. I used to work on the floor, and that's the first time I ever seen skin cancer. To me, it was like the worst thing you ever want to see. And the lady was a federal agent, and she went to the doctor, and they thought it was a skin rash. It turned out to be, skin cancer, So, read up on it as much as you can. If, especially if people who have it, or maybe it's in your family, and you just kind of want to understand how the cancer, period. We're going to read more about all of these subjects. We're going to read more about all of these subjects. We have went through the Language of Medicine book page by page. You see what page we on? 745. Y'all see me on 745? We have went through this page by page. Okay. So this is where I'm at in case y'all are with me. Some of y'all got different pages. Okay, so this is where we are. We're talking about neoplasms. Okay, so some of you guys who have a different book, you might have a different page. But again, you know, the oncology section and medicine section is touchy. But those of you who have your book already, I want y'all to go ahead and start reading the medicine section. Because I want you to go to the medicine section and go to oncology, or go to the cancer section, or go to medicine section to just start from page 1. It's a big section, but I want you to start because it's just like reading medical terminology. Okay. So again, you know, there are benign tumors, non-invasive, not spreading to other sites. Benign tumors grow slowly, and malignant tumors cells multiply rapidly. Put that on the index cards. That sounds like something that's going to be on your test. This one too. I'm telling you, I remember this one back in the days. Put this on your index card. Okay, I'm on page 74. You might have the same thing. I want to show you this because everything that's on this page, I want you to get it. Okay. Benign tumors are often encapsulated, not metastasizing. Contained within a fibrous capsule or cover so that the tumor cells do not invade the surrounding tissue. Malignant tumors characteristically are invasive and infiltrative, extending into the neighboring tissues. Now, I want you to get down encapsulated. Benign tumors grow slowly. Malignant tumor cells multiply rapidly. Okay, so get those two down. Okay, benign tumors are composed of organized and specialized differentiated cells. Okay, we don't need that one. The characteristics of malignant tumors is called anaplasia. Anaplasia. Okay, I want you to get that word down. ANAPLAZSIA. Okay, that sounds like something that might be on your test. Okay. The characteristics of malignant tumors is called anaplasia. Anaplasia, ana means backward, and plasia means growth. That's in your root words that we just did earlier, okay, a couple of weeks ago. So pay attention to those. They're giving it to you as if it was a root word and a suffix, okay. In contrast with the normal differentiated tissue of their own origin, anaplastic cells lack an orderly arrangement. Okay, I'm not going to read that whole thing because you don't need all of that. Well, this is not an invasive picture. Sometimes I don't show them pictures that look a little scary, but that one ain't too bad. All right. So I want you guys to look. That's the anaplastic tumor cells of the skeletal muscle. Okay. Oh man, I can't show that one. This is looking like the liver, a liver study with metastatic cancer. All right, so I'm on a figure 19.2. So y'all look at that figure 19.2, a little bit nasty. I can't show it. Not nasty, but yeah, you know. I can't show that one. Okay, and it's really just giving you an idea. I'm sorry, I'm getting choked up. It's really just giving you an idea of what, you know, cancer looks like when it enters your body. Okay. 19.1A, 1B, that's the one that below. You guys are probably looking at the same thing. Shows normal skeletal muscle and anaplastic malignant muscle tumor cells. Cells from benign tumors do not spread or metastasize. Did y'all hear that word? Metastasize to form secondary tumors, masses in distant places in the body. Get down that word, metastasize. I'm going to give you another one that sounds exactly like it. So I'll have to read that one. So some of you do not have your books. When you do, this is what you're going to focus on. Cells from the benign tumors do not spread or metastasize to form secondary tumor masses in distant places in the body. Okay? So make sure you get that down. Okay? The secondary growth is called a metastasis. Metastasis. Okay, that's just secondary growth. I don't want to read the whole thing. I want y'all to read it. I just want to give y'all that insight. Okay, so metastasize and metastasis. Yeah, got it? It's metastasis. METASTAS. Metastasis. Okay. So this is a good comparison that you guys can also use in your study. So make sure you get that down, and you can always kind of write that down. You guys didn't get that. You can always write that down. Just want you to know the comparison between the benign tumor and the malignant tumor. Okay, so the benign tumor and the malignant tumor. So some of us that do have family that do have either a benign or malignant. Benign, maybe you can cut it out and it's done. Malignant means that it is going to rapidly grow. Okay, so again, tumors, get that down, put that on your card. Tumors are neoplasms. Benign tumors, growing slowly, encapsulated and non-invasive, well differentiated, different. Okay, non-metastatic. Okay, non-metastatic, non-transferring. Okay, malignant, rapidly multiplying, invasive and infiltrative. Anaplastic and underfiltrated, metastatic. Okay, make sure you get that down. Okay, so I'm still on page 748, but we are actually in what causes cancer. Carcinogenesis. Carcinogenesis. What causes cancer? So again, in your CPT book, it will not give you descriptions like this. This is a language of medicine. This is giving you insight on what you're going to see in reports, surgical language that you're going to be hearing, metastasis, metastasize, chromosomes, DNA, ribonucleic acid, stuff like that. Okay, so let's continue on. So what causes cancer? And this is just book descriptions. I mean, you can buy any book you want. Everybody has a different description of what it is, but it's all roundabout almost the same thing. Okay. What causes cancer? The causes of transformation from a normal cell to a cancerous one. Carcinogenesis. Carcinogenesis. Okay. What causes cancer? Carcinogenesis it's a numeric form, all right? They got it in parentheses because they're giving it to you as another word. The cause of transformation from a normal cell to a cancerous one is carcinogenesis, okay? Are only partly understood. What is clear is that the malignant transformation results from damage to the genetic material. Genetic as in our chromosomes, our DNA, right? RNA, good. So, when you guys do get ready to read this, just, take heed to it. Right now, we go through it kind of quickly, but I want you guys are going to take your time going through this, because it's not only us just going through the reading. It's stuff that you do need to know about. When you're in college, when you're in class, this is what we go over. This is how a student learns. The student doesn't necessarily have to be like this in the book to learn. As long as the student is in the classroom and he is adhering to the instructor and what the instructor is saying, the student can go a long way. Nobody goes to college to remember every single thing that the instructor says. If you are there, if you are in the classroom, then you have retained something. If you finish with this class and I send you an email and I say, well, what happened in class today? 2 sentences. You retain what's in the classroom. So, it's just like when you watch TV. When you watch TV, you tell your friends about the movie that happened on the movie that you saw yesterday, because you have retained what's there. So, again, what you learn in the classroom, you take it with you. You do not have to be experts. As long as you can pass a test, we as instructors know that we have done our due diligence. So your homework tonight is to make sure that you read this chapter again. Okay. So when we do it in a classroom, we're just going over minimal. Okay. But you are to read the full chapter. Okay. Again, you may have an older book. You may be on a different page. Okay. So, where we at? Genetic material or DNA of the cells. Strands of DNA in the cell nucleus form chromosomes, which become readily visible under a microscope when a cell is preparing to divide into 2 daughter cells. In order to understand what causes cancer, it is necessary to learn more about DNA and its functions in a normal cell. I don't think I would ever understand what causes cancer. I still don't even decipher what hardly causes diabetes. Everything is different. They change. They change all the time. Okay. So we don't have to kind of get into the nitty gritties in here, but you do need to know what DNA is, deoxyribonucleic acid. Y'all know I can't even say it. DNA. Write that down, put it on index card, and give me a definition for DNA. Ribonucleic acid. Give me a definition for RNA. I don't need nucleotides. May not be. The genes are composed of an arrangement of units called nucleotides containing a sugar, phosphate, and a base. Okay, give me that one. Give me nucleotides. Nucleotides. What you may see on your test is chromosomes, carcinogenesis, DNA, and RNA. Okay, those I want the definitions of. Okay. So here's an amazing picture. It's an amazing picture of DNA and how it is formed. And what's kind of fascinating about it is they're showing the DNA, a person's DNA. So the cancer, to me, in a person's DNA, as a person is born, you already know that they are going to have cancer. Can somebody decipher that for me? Somebody let me know. Y'all let me know what y'all take on that. So in this figure 19.4b, you guys probably have the same figure. The RNA travels from the nucleus to the cytoplasm. Okay, get that down. Cytoplasm of the cell, carrying the coded message that directs the formation of specific proteins. So I take it in this DNA, this is the transformation that's going to go on as a person does get cancer. Okay, RNA takes coded messages to cytoplasm, where proteins are made according to the RNA code. Two functions controlled by the RNA: mitosis, process of cell division. Get that down. Mitosis. Okay, mitosis. Okay. B, protein synthesis, creating new proteins for cellular growth, synthesis. RNA, which is a product of DNA. You guys already got those two down already. Okay, so no, we're not going to read the whole thing, but I want to make sure you guys are in the right place. When you do your homework, you are going to read these chapters. Okay, the specific damage usually involves changes in the cell's DNA codes, creating abnormal genes with changes called mutations. Write that down. Mutations interfere with the accurate synthesis. Okay, I don't know what that is. Synthesis of new proteins and can be passed on to new cells during cell division. I mean, it's unbelievable. The process of this whole thing. Unbelievable. You get this down. Apoptosis, APOPTOSIS. Write that down. Put that on an index card or put it on a sheet of paper because I want you guys to definitely go over that. Normal cells undergo spontaneous distant generation. Okay, am I saying it right? Distinction by a process known as apoptosis. Okay, it's really apoptosis. APO. How y'all gonna pronounce that? APO. I say apoptosis. How about that one? All right, we'll use that. Or programmed cell death. Some cancer cells have lost elements of the program and thus can live indefinitely. Man, that's terrible. I'd like to know what age has the longest living cancer person lived. I'd like to know that. When they got the cancer. Okay. All right, so I can't answer right now. We'll answer you later. Okay, so get that down. Environmental agents. These agents are called carcinogens. We just did that one. Didn't we just do that one? Okay, carcinogens. Y'all get that down, okay? Read that chapter, environmental agents, radiation, chemical carcinogens, radiation, whatever. Its source, sunlight, X-rays, radioactive substances consist of wavy energy. You guys know that. We're going to do radiology soon. This energy causes DNA damage. and mutations. Okay, so you guys can see why people have to get radiation. It kills it. Okay, I'll read it again. Radiation, whatever its source, sunlight, X-rays, radiation, substances, consists of waves of energy. This energy causes DNA damage. Okay, and this is horrible because friend of mine, had lupus, and she was out in the sun. She didn't really know whether she should be in the sun or not. And the sun pretty much damaged her hair, kind of burnt all her hair up. Cause DNA damage and mutations that lead to cancer. Leukemia used to be an occupational hazard of radiologists who were routinely exposed to X-rays. There is a high incidence of leukemia and other cancers among survivors of atomic bomb explosions. That's like the same as 911. Do you guys know anybody who was in the 911? I have a friend who was actually in the 911, and she did get cancer. She did get cancer. She's still with us, though. She's still with us. Some viruses are carcinogenic. Okay, so you guys are going to read that. I'm not going to read that. This looks like a 2-day class right here. So environmental carcinogens, chemicals, radiation, viruses. So you guys go ahead and do that. I just want the definitions of those DNAs, RNAs, to make sure that when you see that on a test, you know what it is. Hereditary. A cancer also may be caused by transmission of DNA. See, this is what I always thought. I thought that it had to be hereditary. I don't think you can catch it. I don't know if you can or you can't, or people who are smoking and then they get it. I know people who have gotten it based on hereditary that never smoked. I mean, people, just got it just based on hereditary from genes. It's already in your DNA. Cancer also may be caused, hereditary. I'm on page 750. Cancer also may be caused by transmission of DNA mutations that are associated with cancer susceptibility. These mutations are found in the DNA of the parental egg or sperm cells and are passed from generation to generation. So when we were at the table, or when we was in the house and we were all holding hands, we all were going, we're going to get it. They're going to get it. You're going to get it. See, I don't have that in my family. We don't have cancer in my family. We have diabetes in my family. A friend of mine, she had cancer in her family. So to us, yes, it just kind of confirms what we all would think, that cancer, it comes from generations. But I still think the smoking and things like that, I think it just contributes to the cancer. Let me show you guys what pages I'm on. So in this page, like I said, it just kind of gives you, I'm at the hereditary part. I think I'm on page 750. It gives you that is it hereditary? How did I get it? Because you could, a friend of mine, he didn't smoke at all, not smoke at all. And sometimes I say secondhand smoke, but if somebody got it, it's passed down. I'm gonna read it again. Hereditary. Cancer also may be caused by transmission of DNA mutation that are associated with cancer susceptibility. These mutations are found in the DNA of the parental egg or sperm cell and are passed from generation to generation. Although most cancers result from chance mutations in the body cells during a person's lifetime, examples of inherited cancers are retinoblastoma, tumor of the retina of the eye. Now, I haven't seen that yet. I haven't seen that yet. So there's just a few pictures down here just showing normal genes versus abnormal. And they're showing examples of genes implicating hereditary cancers. So they're saying that these may be hereditary cancers: breast cancer, ovarian cancer, polyposis syndrome, renal cell carcinoma, Wilms tumor. Some of those are passed from generations to generations. So get that down. Suppressor genes, I want y'all to put that down. I'm not going to read the whole thing. Genetic screening, get that down. Get down to the genetic screening. I'm not going to read that. Y'all can go ahead and read about the genetic screening. I'm on 751. That's in table 19.2. You might have a different page. because inherited changes can be detected by analyzing DNA in any tissue of the body, not simply cancerous cells, but cells called for cancer patients. Family members are tested to determine whether a person has inherited the cancer-causing gene. This is known as genetic screening. Okay? Carcinomas, get that down. I want y'all to read the carcinoma section, okay? Adenoma, carcinoma, gastric adenoma, carcinoma. That's in there. That's 19 to 13 carcinomas, okay? Let me see where we're at. All right, so we're only 35 in. We're only 35 in. Carcinomas and the epithelial tissues. Get that down. I want you to get these. Let me show you. Get these down on the index cards. And when you put them on index cards, make sure you get the definition. Okay? So just write the word at the top of the card and then put the definition down. Because you're building up your study file, I know, I got to call Q back. I got to call her back. You're building up your file. Drop. Thyroid, bladder, prostate, pancreas, breast. Yeah, that's what I want you to get. Stomach, liver, colon. Yeah, get that down. Basal cell layer, yep. Squamous cell layer, get that down too. So when you guys go through the book, go to page 754, and you want to see something that says mixed tissues. I want you to also read that in your homework tonight. And in this section, the oncology section, I want you to also give me a summary. YTU, you can't give me a summary, just do the summary. Okay, just so you can see what you retain from this. Can't show you that picture. So you all can look at some of these pictures, when you're doing your homework. All right. But these words I want you to get, follicular, papillary, diffuse, those three words. Grading and staging. So when grading a tumor, the pathologist is concerned with the microscopic appearance. Okay, the staging of cancerous tumors is based on the extent of the spread of the tumor. Okay, those two sections I want you to get: microscopic grade, extended spread, and stage. Well, yeah, let's get to this part. The cancer treatment. Okay, surgical radiation, chemotherapy, molecular target therapy, and surgery. A debulking procedure can be used to remove as much of the primary tumor mass as possible. We know that. Like you can cut it out, or you can cut into it, cut around it, and try to get all of it. You can. So remember I said when you go on YTU, you can look at different things like that and see videos of surgeries that are done like that. So you can see videos of surgeries. Okay, radiation therapy, oncology, RT. Make sure you get that down. Brachytherapy, small sealed containers or seeds of radioactive material inserted directly into the tumor. All right, so we're not going to go right there because this is a long section. Let me see. Cancer treatment. 745, 719. Yes, so yeah, this is long. Where we at? 758. So we're going to stop. We're on 758. Because this one is coming 758. And put it right here. So this class is going to continue. This class is going to continue tomorrow because I want y'all to give me a summary for what we just did. Okay, I want y'all to give me a summary for what we just did. We're just going to do this for 40 minutes, and that's it. And tomorrow we're going to continue on oncology. So I'm going to cut this class short. I see you guys tomorrow. We are in oncology chapter 19. Okay. So this class is officially over, but look out tomorrow. Your next class is going to be tomorrow. Okay. Look at the rest of those chats before you look at this one.